Yeah, I got it. Okay, so good morning and welcome to today's presentation, 2026 Open Enrollment Highlights and Plan Changes for Retirees and Prospective Retirees. And it is presented by your healthcare facilitators. My name is Ranisha Roberson, and along with my colleague Lilia Huato, we make up the healthcare facilitator team for UC San Diego. Our team supports faculty, staff, retirees, and their dependents with health-related matters and provide guidance on Medicare coordination with UC-sponsored medical plans. To minimize background noise, all phones have been muted, and we encourage you to use the chat feature to submit your questions throughout today's sessions. Please be sure to send your message to everyone and no questions instead of private messages, so no questions are overlooked. We understand that open enrollment can bring many questions, and most of them will be addressed as we move through the presentation. We will also hold a Q&A session at the end to cover any remaining topics. So let's dive right in. Today's agenda, we will start with open enrollment basics. We'll navigate through UC Raise. We'll do a Medicare overview. We'll discuss the 2026 HMO medical plan changes, the 2026 PPO medical plan changes, the Medicare coordinating program via benefits, the 2026 retiree premiums. We'll also discuss member ID cards, non-medical plan changes, and then we'll provide some resources. And again, we'll open it up for questions at the end. Now, for the open enrollment basics. Our open enrollment brochures were mailed out on October 23rd, so you should have received them in the mail by now. The university pulled your mailing address information in September of this year. So if you've moved or changed your address from this date, you will need to go log on to UC Raise and view your booklets online. All premiums listed in the retiree booklets are based on 100% UC contribution. The first booklet on the left was mailed to UC retirees living in California and retirees living outside of California if they have a family member that is not eligible for Medicare. The booklet in the middle was mailed to UCSD retirees living outside of California, and all family members are enrolled in Medicare. And the booklet on the right was mailed to UCSD actively working faculty and staff. Inside the booklets, you can compare plans and costs side by side. And you will also receive information booklets with open enrollment information on how to make changes and where to go from help. Things are changing for 2026. The insurance plan offerings for 2026 are undergoing several important updates. For non-Medicare retirees, there are 4 plan options: UC Care, the UC Health Savings Plus, UC Blue and Gold HMO, and Kaiser Permanente HMO. Health Savings Plus is a new plan that we will discuss in more detail later in the presentation. UC Care and Health Savings Plus are PPO plans that will now be administered by Blue Shield of California instead of Anthem Blue Cross. The Core and UC Health Savings plans will be discontinued or sunset in 2026. UC Blue and Gold HMO will continue to be administered by HealthNet and Kaiser Permanente HMO by Kaiser. For Medicare retirees, available options include UC Medicare PPO with or without prescription drug coverage and UC High Option, both administered by Anthem Blue Cross. Kaiser Senior Advantage will continue to be administered by Kaiser Permanente, and UC Medicare Choice PPO will be administered by United Healthcare. Via Benefits will continue to serve retirees who live outside of California when all family members are enrolled in Medicare. Our non-medical plan remains the same, including dental by Delta Dental PPO and Delta Care USA for dental coverage, VSP for vision, Prudential for life and AD&D, and Nationwide for pet insurance. Open enrollment is the time to consider your options for next year. Are you satisfied with your current medical and dental plan options? Have you recently married or need to add or remove a family member? Are you aging into Medicare next year? Have your health needs changed or do you need more flexibility? If you've previously suspended your health plan, do you need to unsuspend? This is the time to make those changes. We wanted to make sure you did not confuse UC's open enrollment dates with Medicare's open enrollment dates. UC's open enrollment begins today, October 30th, and will end on November 21st. Medicare's open enrollment began on October 7th and will end on December 7th. Please do not get these deadlines confused. The only retirees who need to adhere to the Medicare open enrollment are those who are enrolled in VIA benefits. All changes become effective on January 1st, 2026 for both Medicare plans and UC plans. If you need to make open enrollment changes, they must be completed by November 21st at 5 p.m. Pacific Standard Time. This is a firm deadline, so if you live somewhere outside of Pacific Standard Time, please make note of the time deadline to ensure your changes are complete before open enrollment changes or closes. Now, if you are a recall or a rehired retiree and you have UC's retiree health coverage, you will receive a Medicare survey. Please complete the survey and return it as instructed. When the form asks if you're working, the answer is yes. When the form asks if your group coverage is through your employer, the answer is no. If Medicare is not reflecting as your primary, call Medicare Coordination of Benefits Office at the number listed here and provide them with your retirement date. Now, what happens if you do nothing? Normally, we would say you do nothing, you don't need to do anything if you don't want to change anything, because for most retirees, the current plan selections would automatically carry over. However, with the plan changes and the new options, we highly suggest that you actively participate in open enrollment. This means reviewing your current enrollment in UC Raise, reading over your booklets, and attending as many presentations and webinars that you can to ensure that you're enrolled in the best coverage for you and your family. When you're ready to make changes, you would log into UC Raise. If you have a form to complete, you can also upload those forms into your UC Raise account, and you may also fax or mail your forms via USPS. However, UC Raise upload is the preferred method. So this picture that you see on your screen is the home page for UC Raise. You may have noticed that since October 12th, if you have logged into UC Raise, there is an enhanced login security. Now, after you put in your username and password, UC Raise will send a security code to either your cell phone or email address that you have on file as an extra layer of security. And once you're into UC Raise and you click on open enrollment, you'll be taken to a page displaying your current enrollments and the projected monthly costs for 2026 if no changes are made. If you make changes through the open enrollment application and confirm them, you'll receive a confirmation email upon completion. Afterwards, you can revisit this page in UC Raise to view your updated monthly costs for 2026. It will reflect any changes that you made. You can also add or remove family members on this screen or proceed to the next screen for further options. You would use this page in UC Raise to calculate any changes. For example, if you add or remove a family member, even just to model projected costs, you can do so on this screen, or the previous screen, and then return to this screen where the updated details will appear. Here, you can explore different plans and costs and configurations. Each time you select Calculate Total Costs, the cost will adjust based on any changes in current coverage for medical, dental, and any other plan that we have according to your specific eligibility. Feel free to experiment with different options. No changes will be finalized until you complete the open enrollment process and hit confirm, and you receive a confirmation email. Retirees having any problems logging onto UC Raise with their computer or they're locked out of UC Raise can call the RASC at 800-888-8267 to make changes over the phone. The Healthcare Facilitators Office are also available for assistance with locked accounts and password reset. You may also complete the UBIN 100 form to make some changes. If you have Medicare, you'll need to complete the Medicare form according to the plan you will select for next year, and we'll discuss that during the Medicare overview. So the Medicare overview, if you're aging into Medicare next year, this is the time to review your Medicare plans to make sure that you're in the non-Medicare plan that coordinates with the Medicare plan that you wish to enroll in. If you're currently in UC Blue and Gold, at the time of retirement, you would enroll in UC Medicare Choice PPO. Kaiser Permanente, you would enroll in Kaiser Senior Advantage, UC Care, UC Medicare PPO, and the Health Savings Plus plan. You would have to choose one of the other plans because it is not compatible with Medicare. While the Medicare plans are not changing, the non-medical plans are. So remember, the non-Medicare plan that you have at the time of retirement determines the Medicare plan that you would enroll in. So if you plan to retire at the beginning of the year, make sure you're enrolled in the non-Medicare plan during open enrollment for the Medicare plan you wish to enroll in at retirement. Medicare enrollment can be stressful, to say the least. So UC has provided a fact sheet to assist with understanding Medicare and how it works with a UC-sponsored Medicare plan. This booklet will cover Medicare and what UC requires of you when you become eligible for Medicare, and can be found on UCNet or by scanning the QR code on your screen. UC requires that all retirees over the age of 65 and their dependents enroll in Medicare. If you are eligible for premium-free Part A, you must enroll in Part B. And enrolling in a UC-sponsored Medicare plan is contingent on enrolling in both Part A and Part B, and your Medicare card reflecting both. Failure to comply with this requirement will result in penalties and permanent loss of UC-sponsored medical care. There are two exceptions to this, which are those who retired prior to July 1991 due to not paying into Social Security, and retirees who live outside of the U.S. where Medicare is not required. However, for those who reside outside of the U.S., once you return, UC will require you to enroll in Medicare, and some late enrollment penalties may be assessed by Social Security. Once you enroll in Medicare, you will be paying two separate premiums, one for the UC plan and one for the Medicare coverage. Please note that these premiums are separate, and UC does not control Medicare premiums and vice versa. UC's premiums are deducted directly from your pension check, and Medicare premiums are paid by you either by Social Security income, through Medicare Easy Pay, or quarterly billing. If you're eligible for one of UC's Medicare coordinating medical plans, it's possible that you'll get a portion of your Part B premium refunded to you. That's because the UC contributes toward your retiree medical benefits is sometimes higher than the total cost of the premium. If this is the case, the university will refund the amount that you pay for your Part B premiums to Medicare. This reimbursement is added to your UCRP monthly pension benefit payments. UC does not pay any portion of your Part B premiums directly to Medicare. For 2026, there are important updates to the non-Medicare side. The first is the introduction of a new plan, the Health Savings Plus plan, which will replace both the core and the UC Health Savings Plan. These two plans will end on December 31st, 2025. Another major change is the medical plan administrator for the PPO plans. It will transition from Anthem Blue Cross to Blue Shield of California beginning January 2026. Continue into 2026 with some updates are the UC Blue and Gold HMO and Kaiser Permanente of California HMO, both which will now include Optum Behavior Health benefits as an overlay. On the Medicare side, the following plans will continue into 2026. Also with some updates, UC Medicare Choice PPO, Kaiser Senior Advantage, UC Medicare PPO with and without prescription drugs, UC High Option Supplement to Medicare, and the Medicare Coordinating Program administered by Via Benefits. If you decide to change plans, it's important to know that there are no pre-existing condition exclusions. You may change your plan every year during open enrollment if you're not satisfied with the plan that you are currently enrolled in. Depending on where you live will determine your plan options. The plans listed in black are the non-Medicare plans, and the plans listed in red print are the Medicare plan. All right, let's dive into the HMO medical plan changes for 2026. The HMO plans are UC Blue and Gold, Kaiser Permanente, California HMO, non-Medicare with Optum Behavior Health Overlay, and Kaiser Senior Advantage of California. One of the most notable updates for 2026 is Senate Bill 729, which enhances fertility benefits. This mandate requires that fully insured large group health plans based in California provide coverage for diagnosis and treatment of infertility. While UC already provided coverage for the diagnosis and treatment of infertility, the mandate also expands coverage beyond our current benefits and changes the cost share for them. Currently, IUI, IVF, GIFT, and ZIFT is covered at 50% coinsurance. For IVF, GIFT, and ZIFT specifically, there is a 2-cycle limit, lifetime limit per member max, and prescription drugs are covered at 50%, and all services for infertility do not apply to the annual out-of-pocket maximum. Next year, IVF, IUI, GIFT, and ZIFT are now covered at plan-specific cost shares, which means that if a member needs care and it is an outpatient visit, they will simply pay their copayment for their visit. Also, for IVF, GIFT, and ZIFT, there is up to 3 completed oocyte retrievals per lifetime and unlimited embryo transfers per member. It's also important to note that if a member has already exhausted their current benefit of the 2-cycle limit, they get an allowance under this mandate. So the allowance essentially restarts the clock for the 2 cycles. Prescriptions are also covered at their respective tier levels. So depending on where the medication falls on the tier level, the member will pay the copayment based on that tier. All these services will apply to the annual out-of-pocket maximum in 2026. So essentially, not only will the cost be lower out-of-pocket for members at the time of care, since it's applied to the out-of-pocket maximum, they will pay less overall for the medical costs next year. Another mandate that's going into effect that already was implemented in January 1st of 2025 is Assembly Bill 3059. This bill is aimed to solve 2 major barriers for parents in need of donor milk by making donor milk an essential health benefit covered under commercial insurance plans. This means that all parents with commercial insurance plans in California have access to medically necessary, life-saving donor milk, and their plans will cover it. It's also eliminated the regulatory barrier that previously acquired acute care hospitals to hold a tissue bank license in order to distribute donor milk. Any member with an infant can utilize donor milk without prior authorization or prescription, and there is no limit on donor milk coverage. The next mandate is APL 23-026, Children and Youth Behavior Health Initiative. This mandate requires that all commercial full-service health plans and behavioral health plans provide coverage for mental health and substance abuse use disorder and treatment services provided at a school site when the services are provided or arranged by a local educational agency or public institution of higher education. The services are identified in the fee-for-service reimbursement schedule published by the Department of Healthcare Services. And for this purpose, it is available to individuals 25 years of age or younger if the services are provided or arranged as specified. This essentially means if your child were to utilize behavior health services in a school setting, the school could bill your insurance and the plan would cover the care. The final legislative mandate is Assembly Bill 2843, healthcare coverage for rape and sexual assault. This was implemented as of July of this year, and it requires that health plans and insurers to include and provide coverage for a 9-month period without cost sharing. And if you'd like more detailed information on this bill, you can contact the healthcare facilitator team. Another significant change is UC's making across all the non-Medicare plans is the criteria for weight loss medication. Some may have heard a little bit about this, and the plans will vary in how they will manage members on these drugs in the future state. Currently, the criteria, which aligns with CDC recommendations, is that you have a body mass index of 30 alone and higher, or 27 and higher with the cardiovascular comorbidity or obesity-related condition. You were eligible to obtain weight loss medication. Now in 2026, the criteria is changing for new prescriptions to a body mass index of 40 and higher. For existing members that are already using the medication, they may continue to do so into the next year. For the prescribing physician certifies for medical necessity, and the member must meet the Health Net prior authorization criteria for continuation therapy. Existing members will not be required to have a BMI of 40 or higher, but new members using the medications in 2026 must meet the new BMI requirements. We also want to note that this is centered around the GLP-1 medications, and we know that there are other weight loss medications beyond GLP-1s, but this does not impact the coverage or criteria for GLP-1 medications for those who are using it for type 2 diabetes. Another minor change for 2026 for the UC Blue and Gold plan, Health Net is transitioning its vendor for managing prior authorizations related to musculoskeletal care and interventional pain management programs from Turning Point to Evolent. This change is expected to have minimal impact on members. And additionally, Share Care will be offering 5 new virtual cooking classes available to UC campuses in 2026. Next up is Kaiser. Many of the next few slides you will see have the same information from what we just covered with Health Net from a regulatory and weight loss criteria standpoint. So I'll go pretty quickly through these slides since we have a lot of slides and content to cover. So for SB 729, and the way it is applied to Kaiser is the same way it will be applied to Blue and Gold. Essentially the same 3 completed oocyte retrievals and lifetime embryo transfer limits apply. The allowance under Kaiser also restarts here, and all the services, medications, etc. apply to the annual out-of-pocket maximums and are covered at plan-specific share costs. AV 3059, human milk, is also applied to Kaiser, as does APL 23-026. Both were applied and implemented early for Kaiser, actually in the beginning of this year. The requirement is to apply them, and they are already applied and in effect at Kaiser. The new mandates will be reflected in the 2026 Evidence of Coverage booklets. The same with AB 2843, sexual assault coverage. This applies to Kaiser the same way as blue and gold. And if you want more information, again, reach out to the healthcare facilitator team. Moving on to Kaiser and BMI for weight loss medication. Kaiser changed their criteria in 2025 to their coverage for weight loss drugs and anti-obesity medications to cover only members with a BMI of 40 and higher. So UC retained the coverage from 2024 and 25, and now we have to offer their standard coverage in 2026. So as you can see, the current coverage spans from a BMI of 27 with the comorbidity of beyond 40. This change impacts those members who have a BMI below 40 without any comorbidities. So if someone does have a BMI below 40 and still has a comorbidity listed here, they will still be able to have access to these medications if their provider deems it medically necessary. The continuation of coverage is being handled a little different than blue and gold. It's based on the BMI of the member when they began their treatment. So, for example, if you have someone that started their medication with a BMI of 41, and even if their BMI drops below 40 going into 2026, they will be able to have access to their medications if the provider deems it medically necessary for up to 24 months. On the other hand, if someone started their medication as a BMI below 40 and they're now at an even lower BMI, they will not have access to their medications any longer under this criteria. The member would need to work with their provider to determine the best next steps to assist with their weight loss journey. Kaiser Senior Advantage, the Medicare Part D threshold, catastrophic threshold is changing. It is increasing by $100 from $2,000 to $2,100. This is the true out-of-pocket maximum and will be applied to all of our Medicare Part D plans. AD 2843 also applies to Kaiser Senior Advantage as well. 2 additional plan changes to Kaiser Senior Advantage are the increase to the ER copay from $65 to $100 and an increase to the inpatient hospital copay from $250 to $350. Now we're going to go into the 2026 PPO medical plans. The plan administrations for our PPO plans are Anthem Blue Cross, Accolade, WEX, Navitus, and United Healthcare. We also have a new medical plan vendor for 2026, Blue Shield of California. They will be replacing Anthem and managing UC Care and the Health Savings Plan, Health Savings Plus plan. Now let's look at the medical PPO plans, which include UC Care and the Health Savings Plus plan administered by Blue Shield of California, the Medicare supplemental plans administered by Anthem Blue Cross, and UC Medicare Choice administered by United Healthcare. Now, since Core and the Health Savings Plan are no longer being offered as part of our benefits next year, the next few slides will highlight the changes comparing the Health Savings Plan and Core against the new Health Savings Plus plan. Next year, there will be a change in the provider network and the plan administrator from Blue Cross to Blue Shield of California. Accolade's role as member services and healthcare advocacy for our members remains the same next year. And Navitus will continue to be the medical PPO plan's pharmacy benefit manager. Here is a comparison of the calendar year deductibles and out-of-pocket maximums. They are increasing next year under the Health Savings Plus, except for the out-of-network, out-of-pocket maximum. The family deductibles and out-of-pocket maximums are not embedded, and there is only a single aggregate amount that the family must meet. All out-of-pocket expenses for every family member, including deductibles, co-payments, and co-insurance, are combined to meet one family deductible. The member share cost for in-network preventative care remains the same with no deductible required, and the out-of-pocket preventative care will have a 50% co-insurance after the deductible. That is under the Health Savings Plus plan. Co-insurance for doctor and specialist visits, labs, imaging, mental health, maternity care, and hospitalization are also increasing to 30% and 50% for in-network and out-of-network respectively. This is after the deductible is satisfied. Here are some member share costs for Accolade Care virtual second opinion services through 2nd.MD, as well as acupuncture and chiropractic services. You may have already noticed that the co-payments that were 20% co-insurance this year will be 30% next year, and the co-insurance of 40% will become 50% next year. Members cost share for urgent care in emergency rooms, ambulance, emergency transport, and visits to retail clinics are also increasing from 20 to 30% and from 40 to 50% respectively. Co-insurance also increasing for outpatient services, surgery, maternity care, and hospitalization. There is a $360 per day benefit maximum for hospitalization. Coverage outside the country will still be through Blue Cross Blue Shield Global Care, while only urgent and emergency services are covered today under the Health Savings Plus plan. Next year, the restriction will be removed and members will just be required to pay a 30% cost share. Next, we have the comparison of the pharmacy benefit under the three plans. It is pretty much the same, increasing from a 20% co-insurance to 30 and 40% to 30 and 40% to 50%. This is the end of the plan comparison, so let's look at some other changes. The new Health Savings Plus plan comes with a health savings account, or HSA, that is initially funded by UC with a more generous contribution this year. Currently, UC contributes up to $500 for single coverage. Next year, it will be increasing to $750, and the $1,000 contribution from UC for family coverage will increase to $1,500. The IRS also increased the maximum HSA contribution by $100 for single coverage for a limit of $4,400 and a $200 increase for a family for a limit of $8,750. Catch-up contributions for those members who are over 55 remains the same at $1,000 per year, and Health Equity continues to be the custodian of the health savings accounts for members. Now we want to review the eligibility requirements for the Health Savings Plan and the Health Savings Plus, which is the same except for one rule. Currently, non-Medicare retirees who are not enrolled in the Health Savings Plan while they were UC employees were not allowed to have the Health Savings Plan in retirement. During this open enrollment, the same non-Medicare retirees and their family members will be allowed to change their medical plan to the Health Savings Plus plan. Please note that the Health Savings Plus plan is only open for retirees during open enrollment, not mid-year. This is so that retirees will have their full UC contribution for the year in their HSAs. So what happens when a core or a health savings plan member does not choose another plan during this year's open enrollment? With the core and the health savings plan, members will default into the Health Savings Plus plan. However, families that are in a split Medicare family, so core and Medicare PPO will default to UC Care Medicare PPO. Now, for core members with the Health FSA, any Health FSA balances of $25 or more will become a limited FSA that the member can use along with their health savings account funds to pay for eligible healthcare expenses. Fertility benefits for UC Care and the Health Savings Plus plan. Remember that infertility treatments are and will continue to be provided through WIN Fertility. All infertility services are subject to medical necessity and prior authorization by WIN Fertility. And starting next year, the network of providers through WIN Fertility's formulary and mail order pharmacy will be used for all infertility treatment. All claims will be adjudicated by Blue Shield, but only those approved by WIN Fertility will be paid. Same benefit design, but a different benefit administration and process. The legislative changes that you heard from the HMO plans will not be implemented for the PPO plans. Current benefits remain intact for next year. Pharmacy benefit changes. Navitus has a program called the Access Guidance Services. This will continue to be offered to help members and prescribers navigate the complexities of prescription benefits, and that has manufacturer copay assistance. This affects members with specific specialty medications for like HIV or GLP-1 and other classes of high-priced medications that are filled at specialty pharmacies. Lumacera and Navitus will assist members in enrolling in this program through outreach calls and mailers. And members obtaining their medications through retail pharmacies will also be alerted about this program when they become eligible. Letters will be generated after the member's enrollment, and once the copayment assistance from this program is exhausted, the member will return to their normal share of cost. This is a huge change here also because currently payments made with the copayment card are counted towards the out-of-pocket maximum and deductible, and next year it will not be counted towards the out-of-pocket or deductible. Just as with some of the other plans, criteria for weight loss medications, including GLP-1s, will be covered only for members with a body mass index of 40 or higher. Continuation of coverage may be available for members who began treatment with a 40 or above BMI, and members should contact Accolade for more details. GLP-1 drugs for the treatment of type 2 diabetes will continue to be covered. Travel expense details or benefits for the surgeries listed on the chart are also increasing. The daily allowance for lodging and meals for each eligible person are more generous next year. You can see the amount here with increases of $200 for lodging and now including a food allowance. In addition, gene therapy for ocular disorder has also been added for the list of surgeries eligible for travel expense benefits. Coverage for medical services outside of the U.S. will continue to be provided through Blue Cross Blue Shield Global Care. The Health Savings Plus plan will have a similar design to the UC Care plan offerings, the same covered services through both plans. However, the deductible and coinsurance amounts differ between the two plans. UC Care members will continue to pay 20% of costs after the deductible, which is no change from 2025, and the Health Savings Plus members will pay 30% of costs after the deductible. There are several different travel vaccines for UC Care and Health Savings Plus and the Medicare supplement plans this year or next year. You can see the member cost shares on this slide for each of the plans. Finally, let's review the changes for the UC Medicare Choice Plan administered by United Healthcare. The emergency copayment is changing from $65 to $100 in the U.S. and abroad. The inpatient hospital copay is also changing from $250 to $350 for each Medicare-covered hospital stay in network and out of network. Inpatient mental health substance abuse in a psychiatric hospital will be increasing from $250 to $350. And also they are adding a copay to Part B as in boy drugs, which is in $30 covered under the medical plan. This is to match the office visit copay. The $1,500 medical out-of-pocket maximum would apply since the Part D drugs are covered under the medical plan. Part B chemotherapy drugs and vaccines will continue to be covered without a copay. The Part D prescription drugs, they are adding a deductible to tiers 3 and 4 next year. There'll be a combined $100 deductible on tier 3 and tier 4. Those are the non-preferred brand and specialty drugs, with the exception for covered insulin products and most adult Part D vaccines. The copay tier for specialty drugs is also changing from $30 to 30% of total cost, with a maximum of $150 per script. That's with the exclusion of the out-of-pocket cost for insulin on the tiers, which are capped at $35 per month before the deductible is met. This is a mandate of the IRA, or the Inflation Reduction Act. Medicare Fitness Program will change from Silver Sneakers to Renew Active. This is available to members at no extra cost. And the personal emergency response systems or devices such as Life Alert will be discontinued or no longer covered under this plan. If you have one of these devices and would like to continue using them next year, please call United Healthcare. Members will also have access to the Calm app. This app is a self-paced digital tool that helps members build resilience and develop skills to address emotions, sleep, and mindfulness. Now, we know you have choices about where to receive your health care, and choosing a primary care provider in UC San Diego's health expanding networks means you will get the best in prevention, diagnosis, and treatment options. If you need a specialist for a common or rare condition, you will have access to a team of experienced physicians, researchers, and clinicians at the region's only academic health system. You will also benefit from innovative treatments, and the latest research not available elsewhere in San Diego, Riverside, and Imperial counties. Depend on UC San Diego Health for your healthcare needs, because you and your family deserve nothing but the best. You can call UC San Diego Health in December to schedule your first appointment or your next appointment, even before the plan kicks in January. A representative will also be at the benefits fair on November 7th to answer any questions that you may have about UC San Diego Health. For the Medicare Coordination Program administered through VIA Benefits, they offer access to individual plans to members who live outside of California and are Medicare eligible. Individual enrollment through the program is paired with a health reimbursement account. And as you see on the slide, starting in January 2026, the HRA will be increasing from $3,000 to $4,000 for retiree only. And for retiree and spouse or domestic partner, it will be increasing from $6,000 to $8,000. The maximum amounts are based on 100% graduated eligibility with the full 12 months of enrollment. We mentioned this briefly earlier. The Medicare open enrollment will run from October the 7th to December the 7th. VIA Benefits members should be able to see their 2026 funding in their accounts at the start of Medicare open enrollment, and you will be able to access those funds beginning January 2nd for reimbursement. UC has developed an HRA estimator tool that was launched in September to assist with determining your HRA amount. You can find the tool by scanning the QR code on the screen or by clicking the MCP HRA estimator link. Now we're going to dive into the premiums, which I know everybody's been anticipating. So UC's aggregated contribution remains above floor at 70% for the non-Medicare pre-65 retiree. So UC decided to set the contribution for this group just as the non-Medicare commercial plans are set. UC's leadership approved maintaining the 2024 and 2025 UC cost share of 72.8% for medical and dental combined, which is higher than the standard 70% floor that is set. Contributions for non-Medicare retirees ages 65 plus align with the average contributions paid by UC Medicare retirees. And as we already shared when speaking about the benefits, the HRA has increased to $4,000 per member with 100% graduated eligibility. The rates shown on the following slides apply to retirees who receive 100% of UC's contribution towards their medical premiums. If you're subject to graduated eligibility, we will share an online tool that you can use to calculate your 2026 premium cost. The non-Medicare retirees under 65 will see a contribution reduction for UC Care and an increase for Blue and Gold. While the Health Savings Plus plan is the least expensive plan for actives, it is second behind Kaiser for non-Medicare retirees. Blue and Gold single and child coverage will have a $61 and a $110 increase, respectively. And coverage for two adults will increase by $133, while family coverage will increase by $182. Core members will see considerable increases ranging from $172 for single coverage and $516 for family coverage as they move to Health Savings Plus. Plus, the Health Savings Plan members will see decreases ranging from $98 for single coverage to $278 for family coverage when moving to Health Savings Plus. UC Medicare Choice premiums for members with single coverage is increasing from $42 to $102, and two-party coverage from $85 to $204. Kaiser Senior Advantage continues to have a zero premium and a Part B reimbursement of $185 per member. We are also seeing about $21 or 21% increase for high option for both levels of coverage, increasing from $300 to $364 for single coverage, while the Medicare PPO is decreasing by 34% for both coverage levels, dropping them essentially from around $92 to $60. Single coverage Medicare PPO without prescription drugs continues to see no member cost share and a Part B reimbursement of $185 per member. Non-Medicare members 65 and older, retirees. This group, since Health Savings Plus is a new plan, contributions are set equal to active pay band 2. Health Savings Plus contributions. This is consistent with historical best practices. Contributions will also be an average of the 2025 contributions for core and the health savings plan. Core members will see an increase almost the same as the decrease the health savings plan members will be seeing moving into the Health Savings Plus plan. Blue and Gold is increasing by $20 for single coverage and up to $68 for family coverage. Kaiser will be increasing of about $15 for family coverage and up to $15 for single coverage and up to $50 for family coverage. UC Care will have an increase from $40 for single coverage up to $135 for family coverage. As mentioned earlier, if you are subject to graduated eligibility and would like to have an idea of what your 2026 medical premiums will be, you may go onto UCNet and use the online retiree health plan premium estimator tool. The 2026 Medicare premiums have not fully been released. However, the Social Security office did release a statement that there will be an increase of $21.50 for 2026. So the new premium is projected to increase to $206.50. The rates you are currently seeing on the chart here are the 2025 rates. The Medicare premiums are based on income from 2 years prior. So 2026 rates will be based on your 2024 income. Most people who qualify for Medicare receive Part A premium free if they've paid into FICA taxes for a minimum of 10 years and have 40 employment credits. If you have less than 40 credits, you will pay a premium. For 2024, for those who have 30 to 39 credits, the premium is $285 per month, and those with 0 to 29 credits, the premium is $518 per month. The Medicare Part B will always have a premium, and the more income you make, the higher your premium will be. The 2025 base rate for Medicare Part B for someone making $106,000 or less as an individual, or $212,000 or less for a joint filing, the premium for 2025 is $185 for Part B and $0 for Part D. As you see from the 2025 chart, the premiums increase as the income increases. Also, as with Part A, most have a premium-free Part D unless there is a higher income bracket. You paid what the premium shows on this chart in addition to your UC medical plan premium. No matter if you're enrolled in a UC plan or a commercial Medicare plan, you will always pay two premiums. You'll pay Medicare Part B coverage to Social Security and a plan premium to either UC or wherever you get your other plan from. This is just a quick slide of the Medicare Part D CMS mandates for 2026. It includes the low income subsidies, the TROOP, and etc. TDC, total drug cost. Member ID cards. Member ID cards are expected to be mailed out starting December 22nd, and this applies to all plans. For Kaiser members, the non-Medicare HMO and Senior Advantage, only new members will receive new cards for next year, and UC Blue and Gold HealthNet will send out new cards for all members. For the Health Savings Plus plan, all members will receive one plan ID card for all members. It would include both medical and pharmacy information. New members on this plan will also receive a HSA debit card from Health Equity. If you are already enrolled in the HSA, you will continue using the same current card that you have into next year. All UC Care members will receive one card for both medical and dental or prescriptions. All UC Medicare PPO with prescription drugs and high option members will receive two ID cards, the medical card for Anthem and a pharmacy card from Navitus. UC Medicare PPO without prescription drug members will receive one medical card from Anthem and will purchase a prescription plan from the marketplace and provide proof to the UC of enrollment. All UC Medicare Choice members will receive a new ID card with updated copayment information. The non-medical plan vendors have not changed. We have Delta Dental, VSP, Experian, Nationwide, Lincoln Financial, Prudential, ARAG, and Fidelity. We will start with Delta Dental for the PPO and dental HMO plans. Early this year, the Office of the President conducted a comprehensive dental RFP. to evaluate our plans and provider networks. A key finding was that provider terminations are not unique to Delta Dental. Rather, it is a trend observed across the entire dental industry. However, we are committed to supporting members through these changes and helping minimize disruptions in care. To ease the impact of these network changes, starting January 1st, 2026, we are introducing an enhanced coverage of PPO plan members receiving care from premier and out-of-network providers. What will happen is that the maximum contract allowance limits for sealant, root canals, gum disease, and oral surgery will increase from 75% to 80%. These enhancements are designed to provide financial relief for individuals seeking treatment from non-PPO providers and are projected to result in a total out-of-pocket cost decrease of roughly $85 per impacted member. As a reminder, PPO providers offer the highest value, so we encourage you to use a network dentist whenever possible. The HMO plan design will remain unchanged in 2026. There will be a premium increase of 2.13% for the PPO plans and 2.48% for the HMO plans due to high utilization. UC will continue to pay the full cost of coverage for employees and retirees with 100% graduated eligibility. Both plans are open for enrollment during the OE season. We also included a link to the Delta Dental Provider Search tool on this slide to use when you're seeking a new provider. Moving along to vision, we are continuing our partnership with VSP. There will be no plan design changes. However, the premium rates are increasing by 2% for retirees due to increased utilization and industry trends. The university will continue to provide vision coverage for faculty and staff, and retirees will continue to pay the full cost of their vision coverage directly to VSP. Reminder, changes to your vision plan must be done directly with VSP. RAG will continue to be the administrator of our legal plan. There were no benefit changes or premium changes for 2026. The university is also maintaining their relationship with Experian as the identity theft protection provider and to help bridge the financial literacy gap. Experience recently launched the Credit College program, and it is an interactive course designed to help members understand and improve their credit knowledge. No other changes to the monitoring services, and UC will continue to pay full premiums for faculty, staff, retirees, and children up to the age of 18. Pet insurance continues to be offered as individual policies purchased directly from Nationwide at discount rates. This plan is open for enrollment year-round. The tile will not appear in the portal to enroll. Instead, there is a link in the open enrollment key reminder section and on the confirmation statement. Reminders, their open enrollment ends November 21st at 5 p.m. Pacific Standard Time. Make sure you review all the plan changes and you make your changes using UC Raise. If you need assistance with making changes, the RAS has expanded their phone hours from 7 a.m. to 4:30 p.m. You can use the phone number listed here, 800-888-UCOP or 8267. Changes become effective January 1st, 2026, and Medicare members must complete and return the UBIN forms by Saturday, November the 29th. The next few slides will be several resources for open enrollment and beyond. So we actually save the dates. We will be having a in-person open enrollment fair on campus at the Warren Mall. We will be having this next Friday, November the 7th from 9 to 3 p.m. And representatives from our benefits vendors, network partners, campus partners, We'll all be there with valuable resources, giveaways, informational materials. You can ask your questions and more. Our featured vendors will be HealthNet, Accolade, Delta Dental, REG, Legal, Kaiser, and more. Open enrollment office hours. The Retirement Administrative Service Center will be offering office hours every Thursday from 12 to 1. The dates are listed there, and you can register using the link below. And then the healthcare facilitator team, myself and Lilia, will be having office hours as well on the dates listed with the Zoom links on your screen. Contact information for the healthcare facilitator team, campus HR benefits, health HR benefits, UC Raise, the RAS, retirement counseling, and so forth can be found on this slide. Helpful open enrollment links, including UCNet, Blink open enrollment web pages, retiree health premium estimators, benefit plan contacts, and more can be found on this page. UC Care and the Health Savings Plus plan administrators are Blue Shield, Accolade, and Navitas. We wanted to provide you as much information as you can. They will be having webinars because it's changing from Blue Cross to Blue Shield. From Anthem Blue Cross to Blue Shield. They're doing open enrollment presentations 3 times throughout open enrollment. And we also provided links for provider searches, tier 1s, tier 2, and the Health Savings Plus. So this is also UC Health Savings Plus, PPO plan chart comparison plan documents for UC Care and the Health Savings Plus. Also, Health Equity will be having webinars for the HSA accounts. If you want more information on that, their dates are here and links to register. For Blue and Gold, HealthNet, we do have the summary of benefits, the plan overviews, pharmacy benefits, how to find a provider, and more on this slide. Kaiser resources on this slide, Kaiser Senior Advantage resources, UC Medicare Choice PPO resources. I'm going pretty fast so we can get to the question and answer session. More UC Medicare Choice resources, including links to Q&A segments and their webinar for open enrollment. They only have 1 day, but I believe they're going to record, and we will have a recording of it on our website. UC Medicare PPO and high option resources via benefits, Delta Dental, VSP, and RAG. And we are going to open it up for questions. These slides will be posted on our open enrollment website as well as the video. You can unmute yourself, raise your hand, or place your question in the chat, and we will be answering your questions on a first. Whoever raised their hand or taken themselves off of mute first, I'm going to stop recording.